Hi, I'm Renae Farron. I'm a student at Western Governors University. Today we are going to be talking about sports participation, its benefits, risks, and injury prevention. Obesity is on the rise, unfortunately even in children. Exercise is vital, and sports participation is an excellent source for physical activity. Exercise builds physical strength, agility, and balance, which help to prevent injury. Start early in life for less chance of chronic disease throughout life. Sports involvement has numerous health benefits, but those participating should be aware of the potentially dangerous effects it is having on youth. This is an outline of the things we're going to be discussing today. In an article entitled Research in Sports Medicine in 2005, written by Hoffman, Kang, Feigenbaum, and Radames, children should accumulate at least 60 minutes and up to several hours of moderate and vigorous physical activity on all or most days of the week. End of quote. A study conducted by these same individuals was conducted on 44 fifth grade students. They were tested on their fitness levels. Those that participated in 3 recreational sports throughout the year had significantly higher fitness levels than those who didn't play sports or only played 1 or 2 sports per year. Unfortunately, only 10 out of 44 played 3 sports during the year. The risks of sports participation. Young athletes have different injuries than those in adults. According to Patel and Nelson in 2000 and Michelli in 1995, children and adolescent skeletons are still developing. Quote, acute and overuse injuries involving growth cartilage may seem to be minor, but may cause permanent alteration of bone growth with long-term disability as a consequence if they are ignored. End of quote. Overuse injuries are the most common in young athletes. When muscles, tendons, and other tissues are overused, injury occurs. Rest is needed between athletic events to help bodies heal. Here are some other injuries. Sir, did you have a question?
Yeah. Overall, why are females more prone to ACL injuries than males?
Well, since the pelvis in a female is wider than that of a male, the incline of the thigh bone down to the knees puts more pressure on the knees and more force. When the athlete is fatigued, then that pressure is even increased and there's more chance of injury. Also, the notch at the bottom of the thigh bone, where the ligament passes through, is 20% smaller in a female than it is in a male, and therefore tearing of that ligament is even increased. Here are some more injuries. Specializing in one sport at an early age brings tremendous risk for osteoarthritis from significant repetitive injuries. How do we prevent injuries? Well, parents and coaches can help prevent psychological injuries by having positive reinforcement, regardless of talent. Stress skill improvement, not winning at all costs. Second, mandatory first aid training should be given to each coach by sports medicine professionals. A stocked first aid kit should be provided at each athletic event for each coach. Next, return to play rules should be enforced so that athletes are not returning to play and having re-injuries. Fourth, safety equipment should be provided and required by youth leagues and schools so that injuries do not happen. Fifth, certified athletic trainers or ATCs should be employed to help with conditioning, injury prevention, injury diagnosis and treatment, and return to play procedures. 2 identical studies were performed by the National Athletic Trainers Association. When an athletic trainer was on staff, severe injuries and re-injuries were decreased greatly. Unfortunately, only 42% of high schools in the United States have athletic trainers on staff. Also, to avoid injuries, proper conditioning should be had before the sport is played. Also, keep weight managed and use the proper shoes for the specific sport. Here are some guidelines for athletes and parents. From a certified athletic trainer, Anita Keach, she says, it's hard to take a 16-year-old off the couch and expect him or her to play a sport without injury. End of quote. Encourage fitness early. Get them off the couch and get moving. Limit television and video games and give them active alternatives. Here are just a few. Physical examination before sports participation is also very important. Next, be educated about coaches. Go and observe a coach that you're thinking of having your athlete play on that team. During that observation, ask yourself these questions. If you think, after you've asked these questions of yourself, that it will be a positive experience for your athlete, then encourage participation. When injured, obtain the proper care, as from a sports medicine professional or from an orthopedist, not just from your family doctor. Did you have a question?
Why can't you just see a family doctor?
Well, orthopedists and sports medicine professionals have been specifically trained in that type of injury, and so they'll be able to get you back on the road faster and also avoid re-injury since they treat it correctly. After you've received that treatment from a doctor, the physical therapist should be seen for rehabilitation to avoid re-injury. In conclusion, physical activity is essential to avoid obesity and an increased chance of chronic disease during life. Exercise increases strength, agility, and balance, which help to prevent injury, serious injury, and even lifelong disability. If you do participate in sports, recognize the risks. Prepare the athlete for fitness for the sport and make it fun. Then enormous benefits can be had. With increased physical education in schools, well-trained coaches, and employing certified athletic trainers, likelihood of lifetime fitness and overall health is increased, and injuries will be prevented along the way. Thank you.